I'm Jeff Ferguson, emergency physician with ECU. I'm also the medical director for Pitt County EMS.
And I'm Captain Chad Singleton of the Pitt County Sheriff's Office. Every day, North Carolinians die as a result of drug overdoses. In 2007, more North Carolinians died from drug overdose than from motor vehicle crashes. And painkillers are responsible for more drug overdoses than heroin and cocaine combined.
Overdoses affect individuals directly, but they also affect families, communities, and societies at large. Overdose deaths can be prevented by medical responders and family members.
The goal of this program is to assist law enforcement officers in responding to overdose emergencies. Through its implementation, law enforcement officers will receive training to better help them understand how to deal with overdose victims. First, let's discuss some of the objectives in this program. This program is a result of a partnership between the following agencies: Community Care Plan of Eastern Carolina, East Carolina University Division of Emergency Medicine, Pitt County Emergency Management, Pitt County Sheriff's Office, and Project Lazarus. Project Lazarus is a community initiative in western North Carolina that works to reduce overdoses through doctor and patient education, naloxone distribution, and other measures. It was started in Wilkes County as a response to high incidences of opioid overdoses. In the study area, these overdose rates is down 69% compared to its peak in 2008. Project Lazarus has support of the North Carolina Medical Board as well as the North Carolina Child Fatality Task Force. As of April 2013, North Carolina enacted comprehensive overdose legislation that protects bystanders who call for emergency help during an overdose. It provides immunity from criminal and civil liability for the individual administering Narcan and expands Narcan access to the lay person. The main goal of the program is to reduce the number of deaths associated with opioid overdose through administration of nasal Narcan. As first responders to most medical calls, we have the ability to administer life-saving treatment. The immediate result of reversing the effects of an opioid will allow time for more advanced medical treatment. Naloxone, commonly known as Narcan, is a medication that can reverse an overdose caused by an opioid drug. When administering during an overdose, naloxone blocks the effects of opioids in the brain and restores breathing within 2 to 8 minutes. By binding to opioid receptors, it does not allow the opioid drug to have an impact on the person's brain. It has been safely used by emergency medical professionals for over 40 years and has only one function: to reverse the effects of opioids on the brain and respiratory system to prevent death. It is not a controlled substance, but is a scheduled drug that requires a prescription. It is currently used by paramedics and emergency medical technicians and can be administered intramuscular or intranasal. The effects of Narcan last between 30 and 90 minutes. Opioids are sedative narcotics. They are used in medicine mainly to relieve pain. Opioids suppress the respiratory drive. Risk for an opioid overdose includes changes in tolerance, mixing drugs, physical health, a previous experience of non-fatal overdose, or variation in strength and content of street drugs. There are many commonly used opioids. Most notably, they include heroin, hydrocodone, morphine, Vicodin, and Oxycontin. An overdose is when a body has more drugs than it can handle. Opioid overdose happens when there are so many opioids or a combination of opioids and other depressants such as downers in the body that the brain shuts down breathing. Opioids fit into specific receptors on the brain that have an effect on breathing. If someone can't breathe or isn't breathing enough, oxygen can't get to the brain, and after a very short time the heart stops. This leads to unconsciousness, coma, and even death. The lack of oxygen from slowed or stopped breathing is the key dangerous aspect to an opioid overdose. If you witness someone having an opioid overdose, patient observations will be blue, skin tinged, body very limp, face very pale, slow, erratic, or non-existent pulse or heartbeat, vomiting, loss of consciousness, abnormal, slow, or irregular breathing, conscious but unable to respond. To stimulate the person, call their name loudly. If they respond, they are probably not overdosing, though it is a good idea to watch them closely. Do a sternum rub. Rub the knuckles hard up and down the breastbone. It is important to call 911 and ensure EMS is en route. Consider the use of rescue breathing or CPR. Consider the use of an AED. Consider the use of Narcan. Place the victim in a recovery position if they are breathing but still unconscious. More than one dose of Narcan may be needed. Narcan has no effect on someone who has no opioids in their system. Narcan will not help anyone who is having an overdose different from that of opioids, such as cocaine, methamphetamines, and alcohol, but it will not hurt them either. People cannot overdose from Narcan, and national reports from law enforcement agencies using Narcan indicate that violent reactions upon reversal are rare. At this time, we will distribute materials so that you can learn what policies are required by the Sheriff's Office for the administration of Narcan. Your materials will also include documentation and a refill call.
Now we are going to show you how to remove, assemble, and administer the Narcan kit. Inside each kit you will find one unopened box of Narcan. This contains the syringe as well as the applicator. You will also find a nasal atomizer to be placed on the end of the syringe. There will also be instructions regarding overdose as well as the application of Narcan. Once you have removed the contents of the kit, open the box of Narcan by depressing the tab and removing the syringe and applicator. Gently screw the syringe into the applicator until you feel it tighten slightly. Next, apply the nasal atomizer to the end of the syringe. Push the air from the syringe until a small amount of medication comes out of the tip. Once you have the syringe assembled, place the nasal atomizer inside one of the patient's nostrils. Squeeze firmly to create a jet of mist until 1/2 of the medication has been administered. Switch to the other nostril and squeeze until the remaining medication has been administered. Once all of the medication has been administered, gently roll the patient into a recovery position to allow them to clear their own airway. We appreciate your time today, and we hope this session will be beneficial to both you and the community you serve.
And if you have any questions, contact your immediate supervisor.